Okay. So hi, my name is Mike Griffiths. I'm a paediatric neurologist, but I do research within what you've probably heard of before, Liverpool Brain Infections Group. So we do work on both adults and children. And as you can see from my picture, I work in the UK, but also work in many countries overseas as well. Malawi, Nepal, Brazil, Indonesia, to name a few. Our interest is obviously trying to understand more about brain infections and particularly meningitis. And currently, we're working on studies to try and improve diagnosis, particularly to try and get the diagnosis quicker in meningitis, and also to see the outcome in both children and adults. And it's interesting to hear that Chris, called the lumbar puncture. Actually, one of the things that we're currently funded to look at is a blood test for meningitis. So we're trying to see if we can not replace the lumbar puncture, but at least enhance that. One of the first things you could have would be a blood test to see if you've got meningitis, and then we could move on with the treatment and then move up to doing the lumbar puncture in a more sort of civilized fashion. And then we're working both in the UK and in Indonesia to look at outcomes. But as Chris has said, there's a lot of hidden after effects of brain infections, and meningitis is included in that. Today's talk will cover on why meningitis can cause long-term problems. Then I'll go through some of the hidden or more subtle problems that meningitis patients experience, and it'll overlap a lot with what Chris has said, and then briefly touch on what management options are available. So, as you all know, meningitis is inflammation of the meninges, or the covering of the brain. And as you can see from the picture here, it's the outer layers. And if the inflammation typically stays within those layers, then the problems and the complications that you have are relatively subtle and relatively small. We have more dramatic problems if the infection extends from those layers into the brain. And if you look at that more closely, what happens is that you've got the infection out in the gap between the blood vessels and the brain. And as inflammation builds up, it encourages the white cells that are going by in the bloodstream to go out and seek out that infection and try and solve it. And they'll go out there and they'll try and eat the bugs. But in the process of eating those bugs, they'll probably stimulate more inflammation. And if you have more inflammation, then you can have damage to the surrounding area that can include the brain. So this is a picture of a mouse model, but I just want to show you the sort of how things move from the bloodstream out. So the red in this picture is blood vessels. Black is the space in between the blood vessels and the brain. Purple cells are white cells coming out of the blood, and green cells are what's called tissue macrophages that are already in the space of meninges. And so although we say there isn't that much movement, as you can see, this is in quite an extensive infection that the mouse is having. There's quite a lot of movement of white cells from the blood out into the space in between. So if you do get that movement out, then you might get some more obvious brain damage. Hang on. Ooh. So this is a CT of a young man. As you can see on the left, this is his brain, his skull is showing up right. And you can see we're focusing in on the ear. And on one side, you can see a sort of lots of clusters of circles. That's your mastoid air cells. And on the other side, it's white. And that's because those mastoid air cells are all inflamed. And they would go and inflame the meninges around the inner ear. But if it extends beyond it, it might move into the gray bit, which is the brain tissue. And unfortunately, sometimes that inflammation goes off. And then as you can see in this picture, where the star is, as you've got inflammation of the brain tissue, and where the arrows are, the ventricles or spaces in the brain have enlarged because the normal drainage of fluid in the brain has been perturbed or been altered. So you get what's called hydrocephalus, and the inflammation is called cerebritis or cerebellitis. And so although it starts out as purely in the meninges, it can extend. And actually seeing dramatic changes like this on the on the images is relatively rare. Most of the time, we just see inflammation of the actual brain covering. But what we know from other work, which is called traumatic brain injury, from people that hit as we know now from footballers and things like that, that you can have relatively modest impact with a brain injury, but then it seems to cause damage. And it doesn't necessarily get seen on a scan, but you may see markers that suggest it's damage. And most of the time, that will all settle down, but some of the times that damage might continue. So what subtle problems do meningitis patients experience? We did some work in the UK, and it was published back in 2018, where we followed up 1,000 adult patients in the UK across 42 hospitals. And part of that work was trying to see what the sequelae are, what were the problems were. And the majority of these patients had viral meningitis rather than bacterial meningitis, because that's the commonest form of meningitis that we see in the UK. And we asked people that came out of hospital to fill in questionnaires, and this was about their health status and also a bit about their sort of neuropsychology. And we did it for up to just under a year, 48 weeks. And to have some balance, we also asked some family, friends, or members of patients as a sort of proxy healthy control. Because we didn't push the parents or patients to sort of fill it in, we got a loss that in the 6 weeks, we had quite a lot of people filling in, and then by 48 weeks, it has dropped down. That isn't because the patients had died, it's just that as you all get on with your lives, we're less likely to fill in the sort of a questionnaire that you're sent. It asks a series of questions that are pertinent to sort of, you know, do I have problems doing my usual activities? I have slight problems, moderate problems, severe, unable to do. It doesn't specifically ask about headache, but if you have pain, is it slight, moderate, severe? And then also talks about anxiety or depression. And similarly, there's bits about, does it limit your physical ability? How much activity can you do? Pain again, and then again about vitality. You know, people, how energetic are you feeling? Are you up to doing your work today? So what we found was that grey is the UK norm. So in the UK, actually, Italians show a higher level of this. 1 is absolutely happy, no problems, no concerns at all. In the UK, on average, we're around 0.9, so we're slightly pessimistic, but still majority of the time, we're absolutely fine. And then for patients with viral meningitis, we found that in the first few weeks, there's a real problem that you sort of really aren't being able to achieve what you can compared to the rest of the population. And this improves, but then as you continue over the year, they still never get back to their normal level. So the majority of patients that we saw had 1 or 2 features, some had a lot more, but everybody had some features that continued for those 48 weeks. When you broke it down into what things seem to be a problem, black is a severe problem of level 6, and light grey, level 1, is not too bad. So areas that seem to be a particular problem was vitality, that a lot of people felt that they didn't have energy, and this persisted from 6 weeks all the way to 48 weeks, that not having that energy as they normally did. Other problems were that they had physical symptoms, that they had mental health symptoms. A lot still complained of pain. And then there's also some impairment in sort of limitations of what you could do in your role as a job or around the house, and limitations of social functioning. So across multiple domains that there seemed to be a problem. When you looked at different types of infection, so black is healthy, so this is your sort of normal UK population, slightly older population here, so the normal score is 0.8, and it's lower because they're seeing more problems. And viral meningitis is roughly the same as bacterial meningitis, although there's a slight difference by 48 weeks that bacterial meningitis a bit more. But on the whole, there isn't a dramatic difference between the types of meningitis, but we always see this drop compared to healthy controls. This is another questionnaire, and again, the 2 lines at the top are normal controls, different ages, one's 30, one's 50. But again, all our types of meningitis, they show a drop below that. It's not much, it's subtle, but it sort of persists across the 48 weeks. And so again, people found that they had problems with different aspects of their normal daily activities and pain and vitality. We then looked at more sort of psychological impacts, looking about your memory, which you heard Chris talk about, concentration, motor coordination, So again, all features that Chris talked about. And then we saw whether people felt that these were also problems that they were having. And again, we found that, so healthy control is on the left, and on average, they scored around 7, so they didn't have many problems, occasionally did. Whereas those with viral meningitis or bacterial meningitis were having scores of around 20 or sort of 15, so sort of double or a bit more of the problems that healthy controls are having. And again, between 6 weeks and 48 weeks, those problems persisted. Again, we saw slightly more problems in those with viral meningitis compared to bacterial, but both were raised compared to the healthy controls. And when you looked at what the main problems were, so those are the ones with the bigger numbers, it was sort of fatigue, so sort of mental fatigue and a feeling of mental slowing were the two key things that people, and also a bit on concentration, but it was mainly mental fatigue and mental slowing that people felt was a problem. Now, one of the concerns about our study was that this was patients reporting it, and we didn't have any objective or definite signs of that. But other studies now undertaken in the Netherlands by colleagues of ours, Van der Beek and Brewer, have shown a similar report, and they've actually gone ahead and tested patients. They looked at 79 pneumococcal meningitis patients, and again, compared it to a sort of healthy set of controls. So not as many patients as ours, but they went and did, instead of just relying on reports, went a step further and also did tests on them. And again, problems that were seen was at the top line, you see alertness that was down, and another thing they call cognitive flexibility, which is again like sort of cognitive fatigue. So again, these are the key features that people reported in ours, and again, they've seen it on their survey. So it does seem to be a particular problem. For us, we went up to a year. In this study, they went up to 2 years. And again, it still seemed to be persistent across the population in these times. So there isn't a lot of work on this, but what has been done so far is that it seems to be a significant portion of patients surviving meningitis do have neurological sequelae. They're subtle, and that's a problem that they get missed and people pass them off. Both yourself as a patient and your colleagues around you, your family around you. And indeed, it isn't well known in sort of GP or indeed in neurology that this is a problem. Patients report significant neuropsychological impairments. A high proportion report at least one cognitive complaint. And we see this link that if you have the cognitive problems, you also feel that your quality of life is slightly down. So the fact that, you know, as Chris well described, the fact that you have mood swings, the fact that you feel low mood, then has an impact on the quality of life that you appear to be sort of experiencing. So they work hand in hand from that point of view. So what management options are available? And sadly, currently, there's no specific treatment for what we call mild cognitive impairment. Don't be scared by that name. A lot of us have mild cognitive impairment. It's that ability that you forget where you put down your keys, that you parked your car and weren't sure where it was. And it's about having days where you feel off. And it's an area of active research because it's a subtle, sort of not a dramatic change, but as Chris has described, it can have an impact on your life. And so people are trying to find better ways to improve and understand this disorder. There are some things you can do. So there's certain medications that make sort of fogging and clouding of your memory worse. And these are things like benzodiazepines that you may have been given by the GP at some point to help you sleep. But the downside of that is it can also cause sleep disturbance. And as you probably know, it can also make you feel drowsy during the day. There's other things like antihistamines that we take for hay fever that again can make you feel drowsy or foggy. Opioids, if you're on pain because you have consistent pain, again, that'll impair how bright and how lively you're feeling. There's other things like anticholinergics and proton pump inhibitors. So we don't recommend that you stop these, but if you do have problems, it may be worth discussing back with your GP whether you want to sort of come down on the dose and see how that goes in a sort of trial and see if that improves things, or decide if there's an alternative option of how to manage it. There's also other causes that sort of can worsen your brain fogginess. If you have high blood pressure, then for multiple reasons, it would be good to try and reduce that. We often see this overlap with depression. And the downside of depression is when you are depressed, you will feel mentally slowed, you will feel more forgetful. And so, as has happened to Chris, it's useful to both have cognitive help in counselling and potentially also medical treatment to try and give you that pep to try and get over those periods. Another problem that can help is sleep. So if you suffer from sleep apnea, which is when you're snoring seriously, then that again impairs your quality of sleep during the night. And that means that you're very tired during the daytime. And then that again impairs on that sort of sense of brain fogginess. So again, there's treatments that are available for sleep apnea. So if you did have that problem, that'd be something worth treating. So this is a study from the British Journal of Psychology, where they looked at specific interventions to try and improve this feeling of fogginess. And what's depressing is that if it overlaps this straight line down the middle, it means that on the whole that didn't have any impact. So most of the things that have been assessed in a sort of in a medical trial haven't really had any dramatic impact. There's been a bit of success with psychology in sort of group therapy of psychology. The downside of these tests, these particular studies, is they're done in small number and the quality of the studies weren't great, but they show a sort of possible favor. And what they did was they worked in groups. Often it was helpful to have a partner with you so that they understood the problems that you're having and it gave an awareness of what you're going through. And they gave you things to help memory training, simple things like mnemonics or calendars or notes, face association, recalling things until you didn't make a mistake about it, and also maintaining stimulation with social integration, having homework to do, doing your crosswords, and also just keeping up with exercise. And they found that that sort of helped improve and give you a sort of resilience to manage these areas. So this may help. There's no, as I say, it's a small number of people, 10 people, and it was only, there's a similar study that got an opposite result or didn't show an impact. So the jury's out whether this is dramatically going to change things, but it may help. For yourself, the things that you can do is exactly what Chris suggested, is you can sort of try and make your own remedies and change your lifestyle. So like Chris said, it's important to try and reduce the amount of stress you're having, try and have a regular sleep routine so you don't get tired, so you can promote overall good health. Although physical exercise doesn't directly necessarily have evidence of slowing cognitive decline, it does benefit your heart and generally improves your health and well-being and can improve your sleep. So again, will have an impact that way. Diets low in fat and rich in fruits, again, is a good choice. There's some sort of suggestions that fatty acids are a good yardstick for sort of cognitive health. So again, we'd encourage eating fish. The more you can keep yourself intellectually stimulated, not stressed, but stimulated, again, can have a help that you're sort of giving yourself a muscle memory of your brain to keep things working, keep things playing. It's always better to have social engagement, means more satisfying, you get interaction with different people, those different stimulations come in and help you. And then maybe memory training, as suggested, is sort of like going through repetitive tasks till you get them, and giving yourself prompts will help from that point of view. So there's not dramatic treatments, there isn't a drug out there that makes a difference, but it's about being, if you're aware of it, and as Chris rightly described, if you can find the triggers that are causing the problems for it, then you may be able to adjust your lifestyle to try and help. And similarly, if you've got an understanding partner that you can work with, that'll also help to try and avoid situations that make it worse and seeing if you can get support from that point of view. There is some patient information, it's not great. There's a relatively good site in Cumbria, Northumberland, which goes through a bit about what can be helped with a few tips. The Mayo Clinic over in the States offers similar stuff. So there's a bit of information, but it's not specifically linked to meningitis. And so isn't necessarily, at the moment, there isn't something that fits what Chris is describing perfectly. If you think outside of the UK, there's lots of other problems that you can have. And we're, as Chris says, we're lucky in the UK that we can get prompt treatment. And if we don't have that, then the damage to the brain can be far more dramatic and across lots of different elements of the brain, both in children and in adults. And we're seeing more and more in our patients overseas that there really are some significant long-term problems. And again, they're being missed in places where they have interrupted healthcare or difficulty accessing healthcare. So they're struggling to find this now, and it's a burden that they need to try and resolve as well. So in the future, we need to improve the knowledge on long-term outcomes of meningitis, and that's why it's so great that people like Chris have come to you today to explain what they're going through and what it's like, so that when you get it, you're aware of it, and it's not uncommon, but it's about working through it. And again, it's about improving education of patients, so that's why I'm here, and healthcare professionals. And actually with Linda Glenier on the NICE guideline committee at the moment, trying to encourage that we do try and put in longer term assessments post your acute stay in hospital. And then also simply accessing more information on lifestyle and self-help strategies. And again, accessing not necessarily psychological support, but just a counsellor is really useful. That ability to be able to talk through something without necessarily putting a burden on your partner is often a great release for a lot of people. So I think that's, again, what Chris did is a really good idea. So I'd like to thank MRF for inviting me to talk. There's lots of people that I work with to try and provide this information for you in the studies that we're doing, and happy to take any questions. Thank you.